Hello everyone, my name is Chao and I would like to introduce my research. Evaluating vaccine strategies for varying income countries, promoting health equity for ending the COVID-19 pandemic. Vaccination campaigns are still orderly underway around the world. However, vaccine distribution remains controversial across countries at different income levels. A pandemic has not yet eliminated accompanied virus mutations. Many governments readjusted their COVID-19 strategies that are broadly two types of approach: zero COVID-19 strategy and the mitigation strategy. The zero COVID-19 strategy concentrates on timely control and maximum prevention of the epidemic. The mitigation strategy tends to take relatively loosening restrictions to inhibit the spread of epidemic. Obviously, these controversial and complex problems we are currently struggling with, such as losing social distancing, vaccination schedule for different age groups, booster doses distribution and other problems caused by virus mutation, are in fact the key factor that ultimately determine the adjustment of the national strategy. For example, zero COVID-19 strategy in China is implemented since the proportion of the old in China is increasing year by year, so the well-founded distribution of COVID-19 vaccination in the community exactly needs to be concerned. The most widespread distribution strategy is based on age-related considerations, which mainly advised that vaccinating the elderly first would minimize COVID-19 deaths and hospitalizations. Therefore, we should pay attention to the dynamic impact of the mutant virus on different age groups to adjust the age vaccination strategy and optimize the vaccination sequence of each age group. The United States is also facing the vulnerability of an aging society and the new mutated virus continue. So the vaccination plan for the elderly with an updated booster dose is advancing. Continued virus mutation promotes the living with COVID-19 philosophy gradually, which mainly caused by these viruses remain more transmissible but less virulent than those of the previous lineage. New mutations also affect the host's immunity, which mainly from previous vaccination or infections, and inflict breakthrough infections. Another question that requires adequate attention is how to allocate next-generation vaccine in countries with limited vaccines, especially low-income countries. In settings where the supply of the COVID-19 vaccination is limited, a larger proportion of the population can be vaccinated by extending the interval between vaccinations. Considering the rapid weakening of immunity caused by the first dose, the optimal dosing interval is 8 to 20 weeks, which is the highest benefit-risk ratios for fixed dosing intervals. Given vaccine needs and limited supply, extending vaccination intervals maximizes the health impact of existing vaccine supplies. Thus, we constructed an age-structured compartmental SEIR model to simulate the transmission of Omicron variant in countries with different income levels. The model consists of 8 age groups: 0 to 9, 10 to 19, 20 to 29, 30 to 39, 40 to 49, 50 to 59, 60 to 69, and more than 70. To incorporate age-specific susceptibility, contact patterns, and the fatality rate, the model consists breakthrough infections, decreasing immunity, and main first and second and booster vaccination. We considered different vaccine effectiveness at the following 3 time points: 14 days after receiving the first dose, 14 days after receiving the second dose, 14 days after the booster dose for South Africa, the United States, and China. The distribution problem under limited supply is to allocate supplied vaccinations according to a given objective. We numerically solve the vaccine allocation strategy that targets avoid deaths and infections result from irrational vaccine allocation. We defined the relative efficacy of the first dose, which means the proportion of vaccine efficacy from the first dose compared to the second. Vaccination campaigns are still orderly underway around the world. However, vaccine development and distribution remain controversial across countries at different income levels. Confronted with the dilemma of vaccine allocation, we conduct a comparative analysis of strategies in 2 highly diverse areas: low-income country, South Africa, and a high-income country, the United States. While these 2 countries operate in the absence of control measures environment and there are large differences in vaccine coverage. The result shows a considerable discrepancy across the different countries in adopting the same measures. For example, in the United States with high vaccine coverage, it's more effective to complete the booster dose, while in South Africa with low vaccine coverage, the optimal strategy is prioritizing first dose. Thus, in case of a widespread epidemic, prioritizing first dose for more individuals in South Africa, while urgently need to increase vaccination coverage, can reduce the risk of infection and death. In the United States, while most individuals complete the vaccination, rising vaccination rates among the elderly are essential and urgent for reducing the COVID-19 burden. Considering the relative mortality and the infection rates, given the number of vaccines and the relative vaccine efficiency, we investigated optimization results based on the 2 estimations of population size and the relative risk of mortality in order to qualitatively evaluate the situation. Under the study, while the goal is to avoid death, the choice of vaccination strategy is clearly influenced by the vaccine supply. However, under the study where the goal is to avoid infections, vaccination strategy is inclined to influenced by the relative vaccine efficacy. Another more than 2 years of antiviral struggles and vaccination campaigns. The correctness of the choice of mitigation countries with high vaccine coverage still need to be explored. We select China and the United States as examples from developed and developing countries to investigate the impact of different mitigation strategies on controlling epidemics in countries with high vaccination coverage. A result is obvious when just basic precautions are implemented, such as mask use, limiting time spent outside, etc. The virus will spread and cause a significant outbreak, since the implementation of public place control, such as school closure strategy and restricting the opening hours of specific places, which will lead to a significant drop in a projected number of cases but still failed to reach zero. The outbreak can only be kept under control and stopped more rapidly by adopting strong health measures, such as working from home and tightening containment rules. However, it must be realized that maintaining control will come at high socio-economic cost and mental health challenges. Our simulation results suggested that optimal vaccine strategy is not uniform and was associated with vaccine supply, efficacy, and relative mortality or infection risk. If based on the high protective effect of the first dose, one-dose vaccination should be promoted, particularly for countries lacking vaccines. Improving booster vaccination uptake among the elderly and teenagers under the age of 18 is essential and necessary in order to decrease the COVID-19 burden in the event of a large Omicron pandemic. Our findings show that if Omicron variant epidemic spread in China without preventive controls, it still causes fluctuating infections, with most infections occurring among 10 to 19 age group, deaths occurring among individuals aged no less than 60 years. For eliminating epidemics, appropriate vaccination and social interventions are necessary. Prioritizing first dose is recommended for low-income countries, while supply of vaccines is restricted and vaccination rates are far below the global average. For high-income countries, the optimized strategy to control transmission was to allocate booster dose. At the same time, high-income countries could take a reopening under consideration, but only based on the necessary condition. Current vaccines can still be effective against the COVID-19 epidemic and will not be significantly affected by the new variant. That's my presentation. Thank you for your attention.